For me, I've been a social worker now for the last 16 years and have always kind of focused on one particular area, which is family and childcare. I've always enjoyed working in that area, but I thought I would maybe try broadening that out a wee bit and taking on the role as the social worker within the GP practices. My chosen community was people who have experienced bereavement. I had identified that there were a lot of patients who were attending the practice with low mood mental health, and I suppose seeking the supports from the mental health practitioner and the GP within the practice. And through discussion with the professionals within the practice, we had identified that maybe the bereavement itself, I suppose, was something that we could maybe explore and identify what services there is out there and try to work in partnership with the patients to try to, I suppose, get them kind of more familiar with what community supports that there was. Whenever you dig in deep in one particular subject area, you realise that there were a lot of gaps in our own knowledge, and there are a lot of services out there for patients who do experience bereavement. But I suppose for us it was identifying the immediate kind of support that they needed, not necessarily that one-to-one direct professional response from the likes of the voluntary agencies, but we were able to see, I suppose, even for different age groups, and kind of identified different barriers as well for different people of different cultures, because waiting times, I suppose, are difficult as it is, but then we have the difficulty in terms of getting translators and just being able to cover all areas and also all age groups as well. So it's trying to, I suppose, identify that maybe this is where we need to come together with people who have had the experience and try and include them along with other stakeholders as well in trying to set up a group to identify what else could we do and what else would they feel would be helpful. At this point within my project, I am, I suppose, identifying people who will come together to form a focus group. Because of the sensitivity of the subject area, it's about trying to encourage people, being informative and telling them, I suppose, really what the purpose is of our intentions to meet and try to get a focus group together. For me, attending this course has given me a lot more insight into what community development actually means. Getting out there into the community, seeing what supports are out there, learning for us as well, working together collaboratively with other agencies, promoting ourselves as well within the community as part of their team. For me, I think it's important that we do promote our role, particularly within the GP setting. It's one of the frontline services out there in the community. It has a high demand from people of all ages, of all different needs, cultural backgrounds. Beyond the project of bereavement, it's just about improving my role across all different sections to make sure that everyone, I suppose, is able to access me as the social worker. I may not have the expertise in every single area that I'm kind of tasked to work in, but it's something then that, there is a growing need for us. It's a move forward, I think, for that community partnership working. I found the teaching on the course definitely very informative. We always knew the term community development, but we definitely didn't have an understanding as to what it actually involved and the importance of it within the social work role. It also, I think, helps identify people's perceptions of social workers in a slightly different light, because sometimes we may not always be viewed positively by people and welcomed, but I think we are now more the promoters and the enablers of people within their own lives, and you need the knowledge of how to do this from a community development perspective. You just sometimes just can't go out there and do it, but definitely the teaching of it has definitely enhanced me as a worker over the last 9-month period since I started this course.